Every 40 seconds, someone in the US experiences a stroke. May is American Stroke Month, so it is only crucial that we educate people about the signs and symptoms of strokes. In studio is Kazim Durrani of Stanford Health. Welcome.
Thank you so much for having me.
So I have a quick question for you. I heard about Be Fast. What does that mean?
Oh, spot on, right? So Be Fast is a mnemonic basically we use to help people memorize signs and symptoms of stroke. It goes by B. And the whole idea is to know the signs and symptoms and act on it as fast as possible. So calling 911 is your best bet, right, to seek medical attention as soon as possible. So B goes for balance, so any imbalance. E goes for eye movement, like gaze preference or blindness. F goes for facial weakness or paralysis, so if one side of the face is weaker than the other one. A goes for arm or leg weakness or lack of sensation. And S goes for speech. So any difficulty in speech or any difficulty understanding someone. When these signs and symptoms are present, we strongly encourage calling 911 as soon as possible because we call it brain is crucial for everything, and the cells of the brain, they start to die if they do not get enough oxygen right away.
So if my face goes limp, what is that symptom? Like what causes that?
Yeah, so the stroke is basically a neurological disease, and it's of vascular origin. So what happens is, if this is the brain, I wish I had a brain here, and then this is the artery supplying the brain, and if it is blocked, then you compromise the blood flow to that region of the brain. And accordingly, what area of the brain is affected, you will see the symptoms, signs and symptoms of that.
So I have a question. Is an aneurysm close to a stroke, or is it something different?
Great question. So stroke basically divided into two big categories. Most common one is ischemic stroke, like the blockage in a vessel and the blood supply is compromised. The other one is hemorrhagic stroke. The hemorrhagic stroke accounts for about 10 to 15% of cases, while the ischemic stroke, obviously 80 to 85% of the cases. One of the subcategories is the brain aneurysm, and that can rupture, and that's also can cause basically a hemorrhagic stroke.
Okay, so what if someone's hesitant to dial 911? What advice do you have for them?
Yeah, so we come across this all the time. People are kind of like cautious that they will call 911 and it may not be a stroke, right? When it gets to stroke, we strongly encourage people to call because we feel like time is essence, time is brain, right? So we strongly encourage, because people have a tendency of like waiting and see that signs and symptoms are gonna resolve, and then that's not right, right? That's not right. Every passing minute, approximately, we lose about 1.9 million brain cells.
Wow, that's crucial.
In an untreated stroke. So time is essence. We strongly encourage calling 911 and seek medical attention. Any of those Be Fast signs and symptoms are seen. So
I know Stanford is one of the most leading health institutes out here. So what other comprehensive centers do we have for stroke patients?
Perfect. In the region, we have two. And Stanford being the only JACO certified advanced comprehensive stroke center we have here, we offer both medical and surgical options and treat stroke. Unfortunately, there's no cure for stroke. So sooner the better. If the patient gets to us, we have medical options. We can use clot busting medication to dissolve the clot. And then again, if this is brain and there's a clot in the artery and we dissolve it, the idea is to restore the blood flow again. And the other option is a minimal surgical intervention through which our expert neurovascular surgeon can go in with a catheter and try to retrieve the clot. The idea is, again, to open that vessel and restore the blood supply.
Wow, amazing. So what other preventative measures can we take?
Perfect. So we kind of divide like the risk factors into two groups. One of them is, we call it non-modifiable risk factors. Unfortunately, we cannot do much about it. It's advancing age, we are prone for stroke and previous history of stroke and male gender and whatnot. So, but there's a good chunk of diseases which we can prevent, cure, and treat. And that way we can decrease the risk of stroke. Hypertension, diabetes, high blood pressure, like hypertension, and hypercholesteremia, like high cholesterol. We strongly encourage people to follow up with their primary care physicians and treat those and get the numbers in the right area. So that's one way of decreasing the incidence of stroke. The other thing is lack of physical mobility. Like exercise helps tremendously. Exercise helps in decreasing weight and also increases your good cholesterol. So these are some of the risk factors and remedies one can do to prevent stroke.
Wow, you just gave us a really comprehensive in-look of, stroke patients and how to prevent and have the risk factors diminish. So I'm so glad that you came here, Kazim. I know that our viewers are very happy that you gave them the information. And coming up on our Today Show, we're going to be back with Anna at Apex. Stick tuned to North Dakota Today.